Hello everyone. Today we will talk about the effects of consuming garlic on an empty stomach, benefits and risks, how much is safe, and who should avoid consuming garlic on an empty stomach. Benefits. 1. Immune support. Garlic has long been praised for its healing properties, and scientific research confirms that it can indeed have a positive impact on the body's immune system. Chronic inflammation can negatively affect the immune system. However, research shows that compounds in garlic, including allicin, can reduce inflammation by modulating the activity of immune cells and cytokines. This helps create a more favorable environment for the immune system to function effectively. Garlic can also stimulate immune cells such as leukocytes and natural killer cells. Animal studies have demonstrated that consuming garlic can increase the quantity and activity of these cells, enhancing the body's ability to combat infections. The antiviral action of garlic is also noteworthy. Studies have shown that it can impact various stages of the viral cycle, reducing viral activity. This can help strengthen the immune system and prevent the development of infections. In conclusion, garlic possesses several positive properties that contribute to enhancing the immune system. Its antimicrobial, anti-inflammatory, and antiviral properties, along with its ability to stimulate immune cells, make it an important addition to a healthy lifestyle. 2. Heart health. Garlic is known for its potential to positively influence heart health, and scientific research confirms its role in maintaining heart and vascular health. Scientific evidence. Garlic has long been recognized for its ability to lower total cholesterol and LDL cholesterol levels, reducing the risk of atherosclerosis and heart disease. This has been confirmed by numerous studies, including meta-analyses, which demonstrated an average reduction in cholesterol levels among garlic consumers. Many studies suggest that garlic can help lower blood pressure. It has the ability to dilate blood vessels and reduce resistance to blood flow, leading to decreased arterial pressure. This can be particularly beneficial for individuals with hypertension. Garlic exhibits antithrombotic properties, meaning it can prevent blood clot formation. This is crucial in reducing the risk of thrombosis, strokes, and heart attacks. Antioxidants in garlic help protect heart cells from oxidative stress, which can contribute to the development of cardiovascular diseases. Inflammation is related to heart diseases, and garlic can help reduce inflammation levels in the body. This is important for maintaining heart and vascular health. Overall, garlic's impact on heart health is attributed to its ability to influence several factors associated with cardiovascular disease risk. Regular consumption of garlic can be a part of a healthy lifestyle aimed at supporting heart health. 3. Antioxidants. Garlic has long been celebrated for its healing properties, including being a natural source of antioxidants. Antioxidants play a crucial role in protecting the body from harmful free radicals, which can damage cells and contribute to various diseases, including cardiovascular and oncological diseases. Scientific evidence. Garlic contains a variety of antioxidants such as flavonoids, polyphenols, allicin, and other compounds that help prevent oxidative stress. This is particularly important for health, as oxidative stress is associated with the development of many chronic diseases. Antioxidants in garlic help shield cells from damage caused by free radicals, contributing to the maintenance of cell and organ health, including the heart, liver, and kidneys. Antioxidants play a significant role in protecting the cardiovascular system. Research shows that garlic's antioxidants can help lower cholesterol levels and arterial pressure, reducing the risk of heart diseases. Antioxidants can aid in preventing the development of cancer cells. Garlic contains allicin, which has anti-cancer properties. It can help prevent the development of certain types of cancer by inhibiting the growth of cancer cells. Antioxidants help slow down the aging process by preventing DNA and cellular structure damage. Garlic may contribute to maintaining the youthfulness and health of skin, organs, and tissues. Overall, scientific evidence suggests that garlic is a substantial source of antioxidants that can support health by protecting the body from oxidative stress and associated diseases. 4. Anti-inflammatory effects. Garlic is known for its antioxidant and anti-inflammatory properties, which can have a positive impact on the body. Modern research confirms that garlic may play a role in reducing inflammation within the body. Scientific evidence. Garlic contains biologically active compounds, such as allicin and dialyl disulfide, which can modulate the production of cytokines and the activity of immune cells. This is crucial for maintaining immune response balance and reducing inflammation. Studies demonstrate that garlic consumption can lower the levels of inflammatory markers, such as C-reactive protein and interleukin-6, IL-6. This indicates garlic's ability to diminish inflammation within the body. NF-kappa B is a protein that plays a key role in inflammation regulation. Research has shown that active compounds in garlic can suppress nitrogen monofluoride kappa B activity, leading to a reduction in inflammatory response. Animal studies exhibit garlic's anti-inflammatory effects. One study conducted on rats revealed that garlic extract reduced inflammation levels in the lungs and spleen. Chronic inflammation may be linked to the development of various chronic diseases, including cardiovascular and oncological conditions. Garlic's anti-inflammatory properties could help decrease the risk of such diseases. Overall, there is compelling evidence that garlic possesses anti-inflammatory properties. Its capacity to modulate cytokines, lower levels of inflammatory markers, and suppress nitrogen monofluoride kappa B activity makes it a potentially beneficial ingredient for maintaining health and reducing the risk of inflammatory diseases. 5. Antimicrobial properties. Garlic is renowned for its antimicrobial properties, enabling it to effectively combat various types of microorganisms, including bacteria, viruses, and fungi. Scientific research confirms that garlic possesses significant antimicrobial action. Scientific evidence. Allicin, one of the biologically active compounds found in garlic, is considered the primary source of its antimicrobial properties. This compound exhibits strong antimicrobial and antiviral effects. Studies have demonstrated that allicin can impact various pathogenic microorganisms, including bacteria, fungi, and viruses. Garlic has been used for a long time as a natural remedy for battling bacterial infections. Many studies affirm its ability to destroy pathogenic bacteria, including those that have become resistant to antibiotics. This positions garlic as an important complement to the overall strategy of combating infections. Garlic also boasts antiviral properties. Research indicates that allicin can influence different stages of the viral life cycle, making it an effective agent against viral infections. This can be particularly crucial during the spread of viral diseases. The antimicrobial benefits of garlic have even proven effective in the food industry. Garlic extracts are employed in the food sector to extend the shelf life of products and prevent bacterial proliferation. Garlic is frequently used in alternative medicine for treating infections and supporting the immune system. Some studies confirm its efficacy in this context, although additional research is still necessary to fully comprehend its mechanisms of action. In conclusion, garlic's antimicrobial effects are based on its active compounds, particularly allicin. It can serve as a valuable addition to a healthy lifestyle and a strategy for combating infections. Drawbacks of consuming garlic on an empty stomach. 1. Stomach irritation. There is a prevalent notion that consuming garlic on an empty stomach might lead to stomach irritation and discomfort. However, scientific research reveals that the impact of garlic on the stomach can be intricate and contingent on numerous factors. Scientific evidence. The response to consuming garlic can vary based on each person's individual sensitivity. Some individuals might experience discomfort when consuming garlic on an empty stomach, while others might not be affected. Interestingly, studies show that consuming garlic on an empty stomach doesn't always result in stomach irritation. In certain cases, even with substantial garlic intake, significant influence on the stomach lining was absent. The form of garlic consumption can also influence potential stomach irritation. Garlic extract capsules or cooked garlic may have a gentler effect on the stomach compared to raw garlic. Concurrently consuming garlic with food or as a seasoning can mitigate its impact on the stomach. Food can provide additional shielding for the stomach lining against potential irritation. Individuals with pre-existing stomach issues or sensitive stomach linings might be more susceptible to irritation when consuming garlic on an empty stomach. In essence, scientific data demonstrates that the response to consuming garlic on an empty stomach can be individualized and dependent on several factors. If there is a predisposition to stomach irritation or concerns about adverse effects, it is prudent to consume garlic in moderate quantities and alongside meals. 2. Breath odor. Consuming garlic can lead to breath odor in some individuals, which is a common concern. Scientific research sheds light on this process and offers strategies to manage the unpleasant odor after consuming garlic. Scientific evidence. Breath odor after consuming garlic is due to the release of allicin, an active compound present in garlic. Allicin possesses a strong aroma that can transfer to one's breath, resulting in a distinctive smell. Interestingly, the pungency of garlic's odor can be perceived differently by various people. Certain individuals might be more sensitive to the odor, while others might be less so. This accounts for why some individuals experience a more intense garlic scent in their breath than others. Several strategies can help diminish the unpleasant breath after consuming garlic. Consuming aromatic foods. Research indicates that consuming foods such as milk, apples, spinach, and lemons can help reduce garlic odor. Chewing parsley. Parsley has properties that can temporarily alleviate breath odor. Using mint-based products. Mint can create a sensation of freshness and help mask the garlic odor. Rinsing the mouth using water, mouthwash, or sugar-free gum after consuming garlic can temporarily lessen the odor. Effect on saliva composition. Studies also demonstrate that consuming apples and milk can alter saliva composition, influencing the chemical reaction between allicin and hydrogen compounds in the mouth and thus reducing the odor. While breath odor after consuming garlic is a normal response, employing the aforementioned strategies can aid in managing it. Additionally, these methods can be effective in temporarily reducing the intensity of the odor. 3. Risks for the digestive system. The impact of garlic on the digestive system can be twofold. On one hand, garlic has several positive properties related to digestion, but on the other hand, it can pose certain risks for some individuals. Scientific research evidence. Positive impact on digestion. Garlic has long been used in traditional medicine as a remedy to normalize digestive processes. Its active components, including allicin, can help stimulate the secretion of gastric juices and improve the processes of food digestion. Prebiotic properties. Garlic contains substances that can serve as food for beneficial bacteria in the intestine, known as prebiotics. This contributes to maintaining a healthy gut flora and improving the digestive process. Potential risks. However, for some people, consuming garlic can come with specific risks to the digestive system. Risk of mucosal irritation. Raw garlic can irritate the mucous membrane of the stomach or intestines in some individuals, particularly with excessive consumption. Aggravation of digestive disorder symptoms. People with irritable bowel syndrome or other digestive disorders may experience worsened symptoms after consuming garlic due to its ability to cause gas and discomfort. Interaction with medications. Garlic can interact with certain medications and affect their effectiveness, which can impact the digestive system. For most people, consuming garlic in reasonable amounts can be beneficial for digestion. However, if you already have existing digestive issues or are sensitive to certain components of garlic, it's advisable to be cautious and monitor your body's reactions. 4. Allergic reactions. The influence of garlic on allergic reactions remains a subject of research, and there is currently no consensus regarding its exact impact on allergies. Some studies suggest that garlic can have both positive and negative effects on allergic reactions, depending on the context and conditions. Scientific research evidence. Anti-allergic properties. Some studies suggest that active components of garlic, such as allicin and quercetin, possess anti-allergic properties. They may help reduce inflammation and allergic-type reactions, including histamine release. Potential reduction of allergic reactions. Animal studies have shown that garlic extracts can lower the level of immunoglobulin E, IgE, which is associated with the development of allergic reactions. This suggests the potential of garlic to reduce allergic sensitivity. Impact on food allergies. Several studies suggest that garlic may help reduce allergic reactions to certain food allergens, such as nuts or dairy products. However, the results of these studies are conflicting and require further confirmation. Possible allergens in garlic. On the other hand, garlic itself can be an allergen for some individuals, triggering allergic reactions. Some people may experience an allergic reaction to allicin, which is one of the active components of garlic. Overall, the impact of garlic on allergic reactions depends on various factors, including the type of allergy, garlic dosage, and individual body characteristics. Currently, there isn't enough specific data to make definitive conclusions about its effectiveness in treating or preventing allergies. 5. Interaction with medications. The interaction of garlic with medications can be an important aspect to consider. Some studies indicate the potential influence of garlic on medication effectiveness, which could have serious health consequences. Scientific research evidence. Impact on anticoagulants. Garlic can affect blood clotting, potentially interacting with anticoagulants like warfarin. Uncontrolled consumption of garlic in such cases could enhance the effects of anticoagulants, leading to bleeding. Effect on antihypertensive medications. Garlic can also impact antihypertensive medications, lowering blood pressure. This could pose a risk of excessively low blood pressure for patients taking antihypertensive drugs. Interaction with immunosuppressants. Research suggests that garlic may reduce the effectiveness of immunosuppressive medications used to suppress the immune response. This could be particularly important for organ transplant recipients. Influence on antiretroviral drugs. Some studies indicate that garlic can affect the processing of antiretroviral drugs in HIV patients, potentially impacting their effectiveness and safety. Potential enzyme effects. Garlic can influence the activity of enzymes involved in drug metabolism in the body. This could affect the speed of drug processing and, consequently, their effectiveness. It's important to understand that garlic's interaction with medications can be highly individual and dependent on various factors, including the type of medication, dosage, individual patient characteristics, and other factors. If you are taking any medications and are considering using garlic as an additional remedy, it's recommended to consult with a healthcare professional. Recommended dosage. It is generally recommended to consume no more than 1 to 2 cloves of garlic on an empty stomach. However, individual tolerance can vary. Who it's suitable for: 1. Adults with normal digestion can try consuming garlic on an empty stomach, starting with small doses and assessing the body's reaction. 2. Health-conscious individuals. People aiming to maintain overall health and immunity should consider moderate consumption of garlic on an empty stomach. 3. Vegetarians and vegans. Garlic can be a valuable source of bioactive compounds for those who exclude meat from their diet. 4. Individuals with chronic conditions or those taking medications are advised to consult a doctor before increasing consumption of garlic on an empty stomach. Who should refrain: 1. Children under 2 to 3 years old should avoid consuming garlic on an empty stomach due to possible stomach reactions. 2. Individuals with ulcers, gastritis, or other digestive problems should refrain from consuming garlic on an empty stomach. 3. People with allergies. Individuals allergic to garlic or those with allergies to similar foods should avoid consuming garlic on an empty stomach. 4. Prior to surgery. Before planned surgeries, it's advisable to avoid consuming garlic on an empty stomach to prevent effects on blood clotting. 5. When interacting with medications. People taking medications should consult a doctor before consuming garlic on an empty stomach. Consuming garlic on an empty stomach can be beneficial, especially when combined with other ingredients that can enhance its positive effects. Here are a few recipes featuring garlic on an empty stomach and their potential benefits. 1. Garlic milk. Ingredients: 1 tablespoon of minced garlic, 1 cup of warm milk. Recipe: mix minced garlic into warm milk and consume on an empty stomach. Milk can help mitigate the sharpness of garlic and reduce potential stomach irritation. Benefits: the combination of garlic and milk can support the immune system and have a favorable impact on digestion. 2. Garlic lemon drink. Ingredients: juice of half a lemon, 1 to 2 cloves of garlic, 1 cup of water. Recipe: squeeze the juice of half a lemon, mince the garlic, and mix with lemon juice and water. Consume on an empty stomach. Benefits: the garlic lemon drink can provide the body with vitamin C, antioxidants, and garlic's antimicrobial properties. 3. Garlic honey. Ingredients: 1 to 2 cloves of garlic, 1 tablespoon of honey. Recipe: mince the garlic and mix with honey. Consume the mixture on an empty stomach or add it to tea. Benefits: the combination of garlic and honey can have antibacterial, anti-inflammatory effects, and support the immune system. It's important to remember that the body's reaction to garlic on an empty stomach can vary individually. If you have chronic conditions or are taking medications, it's recommended to consult a doctor before making changes to your diet.